Hi everyone, I have posted many videos about the basal implants. Today briefly I will explain about all precautions you need to take while placing the basal implants, as well as the selection of the patient, the age factor, all those things should be considered while doing the implant case, basal implant case, whether it's a partially edentulous or it's a full mouth case, FMR case. So main thing is the selection of the implant size, shape, as well as the anatomical structures surrounding the mandible and the maxilla, and as well as age of the patient, all should be taken into consideration. First, we start with the selection of the patient. Suppose if the patient is willing to go for the implant placement, whether the patient is an adult or it's a geriatric patient, so you need to look for all the features. It means the oral findings as well as his medical history, all those things has to be taken into consideration. For example, in the oral findings, first to start with, you just check the oral cavity where the implant has to be placed. That is the oral examination. So you look for gingivitis or periodontitis or any other any other disease related to the oral cavity. So along with that, you need to correlate all the things with the OPG or CBCT to place an implant in that particular position. So the oral findings, your oral OPG, and as well as the CBCT will play a major role in selecting the size, shape, as well as the length of the implant. Okay, so this is about the size, shape, and length of the implant depending upon and your findings in the OPG or CBCT. So that has to be done, that all these things need to be evaluated properly, then you go for the placement of the implant. So coming to the anatomical structures, which are very important while placing the implant in the mandible as well as the maxilla. So I'll explain in the mandible. In the mandible, the main important thing is the mandibular canal or its inferior alveolar nerve, IAN. Okay, so this has to be taken into consideration where the mandibular canal is running, whether it is close to the crest or it's away from the crest. So it all depends on the age of the patient, also where the IAN is located. Through the OPG or CBCT, you can measure where exactly is the IAN running in the mandible, whether it is running in the middle or whether it is running more towards the buccal or whether it is running more towards the lingual. All you can evaluate through the X-rays. Okay, so this is the main anatomical structure while placing the basal implants as well as the conventional implants in the mandible. Okay, so next is the mental foramen. Mental foramen usually comes between the first premolar and the second premolar. It usually lies below the root of the second premolar, more towards the mesial end. Okay, so this mental foramen, where the inferior alveolar nerve exits the mental foramen and gives two more branches, that is incisive branch and the mental branch, okay, which supplies the anterior tooth. Okay, so while placing the implant in the mental foramen area, you have to be careful. Your implant should be always 2 mm short of where your mental foramen is located. Okay, it should be 2 to 3 mm short. Okay, or otherwise, if you have any doubt while placing the implant, you avoid that area. Don't place an implant in the that is between the second and the first premolar. Okay, second premolar and the first premolar, you avoid that area. So you have to be careful while placing the implant in the mental foramen area. So on the back, after the second premolar, when you are planning to place the implant in the molar area, you have to properly measure the length between the crest as well as the that is the superior border of the mandibular canal. So what is the length from the crest till the superior border of the mandibular canal? That plays a major role in placing the length of the implant. Okay, if you are doubtful or confused, you have to correlate all the things in the CBCT as well as the OPG. So length is very important, so you are not going to injure IAN. Okay, so your implant always should be short of IAN where it's running. Okay, so usually 2 to 3 mm shorter is fine. Okay, so that is the thing. When in doubt, you place lesser length only. I mean, you 4 to 5 mm short of the that is the border of the superior border of the mandibular canal. That is mandibular canal. So thing is, after you are going to measure everything about the length as width as well as, carefully how to place the implant in the molar area as well as the premolar area. Okay, so what I'll explain to you now, you should take all these things into consideration. Okay, and while placing the implants in the anterior mandible, you need not to worry. So if you are angulating your implant from little lingual towards the buccal, it will be fine, and don't ever perforate the inferior border, that is where the mandible in the anterior mandible, you should not supposed to perforate the that is the lingual area, that is floor of the mouth. You are not going to perforate the floor of the mouth. If you are going to perforate the floor of the mouth that is anterior to your tongue, so there will be anastomosis of many capillaries, which are the branches of the mental artery. So you will get, it will bleed. These anastomosis of capillaries will bleed more. So there are chances that if you are going to perforate, the lingual portion, okay, in the anterior mandible, that is, if you are going to perforate the floor of the mouth, there are chances that there will be hemorrhage. Hemorrhage in the anterior mandible, it will happen, and there will be blood clot formation will be there, and there will be hematoma later on. Okay, so the hematoma, it will not subside by itself. It has to be medicated, otherwise it will subside by itself, and it will take longer time. So avoid perforating the floor of the mouth. Okay, so these are three things. What I have explained is your mental foramen area. In the anterior mandible, you need not to perforate the floor of the mouth, and also the position where the IAN, inferior alveolar nerve, running in the mandibular canal. These all the three things should be taken into consideration and should be properly evaluated before placing an implant in the mandible. Okay, coming to the